IABP, the show goes on but all that glitters is not gold. Authored by Ilaria Chirichilli, Chiara Santo, and David Rose. Cardiogenic shock is the most common cause of in-hospital mortality and morbidity associated with acute myocardial infarction, 7% of these patients. Mechanical cardiac assistance. The intra-aortic balloon pump, IABP, is a catheter-mounted balloon positioned in the descending aorta. It actively inflates in diastole and deflates in systole. Increases diastolic blood pressure. Improves coronary blood flow. Reduces afterload. Decreases left ventricular workload. American and European guidelines for the management of ST elevation myocardial infarction. IABP use for cardiogenic shock has been downgraded from a Class IB and IC, respectively, to a Class IIA and IIB recommendation.
O'Gara PT ETAL 2013 ACCF/AHA Guidelines for the Management of ST Elevation Myocardial Infarction, a report of the American College of Cardiology Foundation/American Heart Association Task Force on Practice Guidelines. Circulation 2013, 127 E362-425. STEG PGETALESC Guidelines for the Management of Acute Myocardial Infarction in Patient Presenting with ST Segment Elevation. Your Heart J 2012, 33:2569-619.
IABP Shock 2. No survival benefit in the short-term follow-up on no significant differences in terms of 30 days all-cause mortality between the two groups. Absence of significant differences in terms of mortality between IABP and control group at 6 and 12 months. Tila H., Zimmer U., Newman F.J., Ferenc M., Ulbrich H.G., ET-AL intra-aortic balloon counterpulsation in acute myocardial infarction complicated by cardiogenic shock, IABP Shock 2 final 12-month results of a randomized, open-label trial. Lancet 2013, 382:1638-45. The routine use of IABP in patients with AMI with or without cardiogenic shock or patients undergoing high-risk elective PCI is not supported. Prophylactic use of IABP may be considered in high-risk patients undergoing CABG, although further large-scale multi-center trials are needed.